This segment is sponsored by VCU Health Hume-Lee Transplant Center.
The doctor is in and you have questions. Transplant patients certainly are unique, and the medicines that they take to prevent organ rejection can weaken an ability to fight infections. Dr. Megan Morales, Director of Transplant Infectious Diseases at VCU Health Hume-Lee Transplant Center, joins us. She's ready to talk more about the vaccine and why it is safe for transplant patients. Dr. Morales, it's great to see you.
Good morning, Jessica.
My first question for you is to talk us through a little bit about your role there at VCU Health and to share more about why transplant patients should get the vaccine.
Absolutely. So our team with Transplant Infectious Diseases works very closely with our transplant colleagues to both prevent and treat infection, both before, during, and after transplant. So although we've seen a wide range of symptoms with COVID-19 infection in our transplant patients, it is more likely that they may have severe infection requiring hospitalization or care in the ICU. So for that reason, we do recommend that they get vaccinated. And importantly, the vaccine is safe. There's no live SARS-CoV-2 virus, which is the virus that causes COVID-19. So the vaccine cannot pass on coronavirus.
Really important things to consider. And in that conversation, is there a timeline for that? When should they be getting the vaccine and should they wait?
So the vaccine is now available to all transplant patients age 16 and older. So we recommend that patients check the VCU COVID vaccine page or the Virginia Department of Health website and vaccine registration process there. Additionally, they can always call their transplant coordinator for more information about how and when to get the vaccine. The only time to wait may be after a recent transplant, and we can discuss that one-on-one in terms of timing. But for the vast majority of patients, they should be able to get the vaccine at this point or very soon.
Dr. Morales, if a transplant patient has already had COVID-19, should they still get vaccinated?
Jessica, that's a great question. So for patients who have had COVID-19 infection, yes, they should still get the vaccine. They should wait until they're fully recovered from COVID. And they may have protection for some degree of time, but the vaccine will give them additional protection against getting reinfected with COVID. If they did receive monoclonal antibody or convalescent plasma as a part of their treatment, then it's recommended to delay vaccination by 90 days.
If they are waiting for a transplant, should they also be vaccinated?
Yes, we do recommend that patients should try to get a COVID vaccine before their transplant if possible. Many of the patients that are awaiting transplant may have diabetes, high blood pressure, or advanced kidney disease, which can all put them at increased risk of severe COVID-19 infection as well. Ideally, we would finish vaccination 2 weeks before transplant, but sometimes we don't know the timing of transplant. And so we would not delay anybody's transplant if they had a more recent vaccine.
That makes sense. Dr. Morales, there's a lot of curiosity and conversation about the different types of vaccines. Is that something that transplant patients should consider? Is there one that transplant patients should be seeking out?
So currently, all of the authorized vaccines in the United States have very high rates of preventing severe COVID-19 infection. So the current guidance is for transplant patients to receive whatever vaccine is available to them first. That being said, transplant patients traditionally have had decreased response to vaccines, such as the influenza vaccine that we know from prior research. Transplant patients were excluded from the early COVID-19 vaccination trials, which is typical, but there are active studies underway now to help us advise patients better in the near future in terms of dose, timing, and selection of vaccine. But the most important take-home message for right now is that patients should receive a vaccine, whatever's available to them, and continue both before and after vaccination to still practice hand hygiene, mask wearing, and avoidance of crowds. Any recent transplant patients within the last 1 to 3 months can discuss the timing of their vaccination specifically with their transplant team, as they may need to delay a little while.
As we all make this journey together, it's incredibly helpful to have some answers for these unique circumstances. Dr. Morales, thank you so much for talking with us.
Thank you.
Our pleasure. We're going to share some more information. You can visit vcuhealth.org/transplant or call 804-828-4104 or find them on Facebook by searching VCU Health Hume-Lee Transplant Center and on Twitter and Instagram at VCU Transplant. Stay with us. There's still much more Virginia This Morning.